There are commercially available multifocal contact lenses that do show efficacy, and specifically the ones that have a centre distance design with the near section in the periphery. There is a bit of evidence to suggest that they are effective. There is also ongoing research into special designs contact lenses, both from our institution and other places around the world, and these hopefully will be available in the near future in a single-use design, and these do have the promise of being even more effective than standard multifocal contact lenses. There is a degree of evidence to suggest that the longer you wear the correction, the better the result is. So it's not something that you would say use as a part-time once a week option. That doesn't do much in terms of slowing down the rate of myopia progression. So I would recommend for effective control contact lenses prescribed as an alternative to glasses. So in other words, as long as you possibly can 7 days a week. And with contact lenses that are available today in single-use form, there's generally no problems with wearing contact lenses these lengths of time. Generally speaking, if you're talking adults and contact lens wear, you'd probably want to see them about twice a year, once a year as an absolute minimum. For myopia control, that would be the absolute minimum, but you'd probably want to push them, at least in the early stages, to every 3 months. When things are settling down and things don't appear to be changing much, probably every 6 months with a full review of how short-sighted they actually are at that point, so you can gauge progression. If you leave it long enough without doing anything, eventually the rate of myopia progression will plateau, often sometime in the early 20s. When you start to get a plateau in the effect, that could be a time to consider not prescribing or to stop the multifocal treatment. But the other alternative is, if you've got someone even as a young adult who is able to effectively wear the multifocal correction, then there's no problem in continuing on with that treatment as their form of contact lenses. And we've certainly done trials in Sydney where we've looked at children from the age of, say, 10 wearing multifocal contact lenses, and have continued in trials well into their 20s, and they had no problems from a visual perspective in wearing those lenses. If you're not having any visual problems, if you're well adapted to the contact lenses, I don't think there's any problem in maintaining that correction until at least mid-20s. Over the next couple of years, we will have lenses specifically designed for myopia control. The lenses, so far what's available is generally a commercial product modified for a different use, but I think we're going to have designs specifically to target myopia control, which have the promise of being more effective than something that's used off-label.